Hi, my name is Lynn. I'm a level 1 nursing student. Is it okay if I follow you today?
Yeah, sure.
Do you mind giving me your S-bar?
Yeah, my name's Lydia. The patient we're going to take care of today is Martha Yarn. She's an 80-year-old Hispanic female. She's in room 529. Her doctor is Dr. Jolly. She has a full code with no known allergies. She was admitted directly from the physician's office to the unit with a stage 3 non-healing sacral ulcer. She has a surgical debridement planned for tomorrow. I did assess her wound, and it measures 4 centimeters in diameter, 1 centimeter in depth, and full thickness tissue involvement. Edges are macerated, and surrounding skin is reddened. The ulcer cleaned with normal saline and covered with the hydrochloride dressing per the doctor's orders. She is on a regular diet, but the doctor has ordered her to be on a nothing by mouth diet by midnight. Her non-healing sacral ulcer of 3 months duration. Patient has been treated as an outpatient without success. She has been admitted in the past for dehydration and pneumonia. The last admission was 6 months ago. For her assessment, she is slightly hard of hearing. She is alert and oriented ×4. She is cooperative but anxious. Her pupils are equal, round, reactive to light and accommodation. Regular S1, S2 with no murmur. Capillary refill is less than 3 seconds. She has a non-productive cough but is breathing even and effortlessly. Chest expansion is symmetric, clear auscultation in all fields. Anterior and posterior diminished in bases. For her GU, soft hip palpation, bowel sounds, GI, bowel sounds are present in all quadrants, and she reports a last bowel movement was Tuesday, and it was firm. Her skin is frail, thinning skin, intact except for the sacral ulcer. She is dry, warm, with good elasticity, good skin turgor. She does have a 20 gauge IV in her right arm. She moves all extremities with full range of motion, ambulates with a walker. Her last lab results, I seen some abnormals. Her albumin was low with a level of 3.2 and high white blood cells in the differential. And her culture did come back with a positive for E. coli. And she did have a chest x-ray and a 12-lead EKG are pending. Her last vital signs were taken at 14:15. Her respiratory rate was 24, pulse was 88, blood pressure was 144/90, and O2 stats were 92%. She states her pain is sharp, she last stated her pain was sharp, and it was a 6. I'm going to check her pain again to see if it still is at that level, because she does have Percocet 5 milligrams per 325 milligrams at 1500. She also has ordered morphine 2 milligrams IV every 2 hours PRN. And so, like I said, I'm going to go ahead and make sure she's not feeling any pain, or if she is feeling any pain, I'll go ahead and give her something for that. There is an order for continuous sodium chloride at 0.09% with potassium chloride at 20 milliequivalents per 1,000 milliliters to be run at 125 milliliters per hour, and a secondary of gentamicin at 80 milligrams per 100 milliliters piggyback every 8 hours. And so that's why I'm about to go in there and give her right now. That's about it for S-bar. Do you have any questions?
Yeah. Why specifically is this client receiving this medication?
This medication is an anti-infective. So her the sacral ulcer that she has presented with E. coli. So this is the E. coli is a gram-negative bacteria, and it has a sensitivity to the gentamicin, so it's going to fight off that infection.
Okay. What action does the medication have on the body?
It inhibits protein synthesis of the bacteria at the level of 30 S ribosomes.
Okay. When should you question administering this medication?
If she showed any signs of hypersensitivity to the medication, the medication is also excreted through the kidneys, so it is used cautiously for patients with renal impairments.
Does this medication have a therapeutic serum level?
Yep, the normal target level is a peak of 5 to 10 micrograms per milliliter, and trough is 2 to 4 micrograms per deciliter.
And which vital signs must be monitored?
I'm going to monitor all her vital signs, make sure I'm monitoring her intake and outputs, to make sure her kidneys are still working the way they should be. I'm going to monitor her weight, her serum creatinine, her BUN, also for the renal functions.
Okay, which physiological... Oh, did I already ask that?
No, you didn't.
Oh, which physiological parameters should be monitored when the medication is being administered?
The signs and symptoms of like an allergic reaction. So like any signs of like hearing loss, loss of balance, since these are the side effects of the medication.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
She needs to stay hydrated. We need to make sure that she's getting all her fluids. She's drinking lots of water. She's aware of the hypersensitivity and how that might be presented with like tinnitus or vertigo, loss of hearing, rash, dizziness, or difficulty urinating.
What interventions must be taught for taking the medication safely at home?
Again, she needs to recognize those signs and symptoms of like hypersensitivity. So if she is experiencing any of those signs, she'll let her provider know. If she's experiencing those signs here, she'll let us know. Also with the medication, depending on how it's going to be given, she needs to be make sure she's taking it all the way through the regimen and not skipping any doses.
What are the side effects and potential adverse reactions?
I've said this a couple times, like since it could present with hypersensitivity, so like vertigo or ototoxicity.
15 seconds. Okay, and how will you know the medication is effective?
Oh, that would be once the signs and symptoms of the infection had resolved.
Okay, that is all I have.
Okay, and I'm ready to go in and give the medication to Miss Yarn. Do you want to come with me?
Sure.
Okay. Knock, knock, knock. Come in. Hello. Hi. How are you doing? Good. Good. So today I'm going to be giving you some medication. By the way, my name is Lydia. And this is Lynn. She's a level 1 student nurse. If that's all right with you, she comes in and watches.
Yeah, that's fine.
Okay. So today I'm going to be giving some medications. We have a primary, which is going to be it's just sodium chloride with potassium chloride, and that's just going to be continuously run through your IV slate. And then with the secondary of gentamicin, which is going to be run every 8 hours. So, and gentamicin is, have you ever heard of it before? No? Okay, it's an antibiotic. It's going to, it's anti-infective. It's going to pretty much take care of that infection that you have. We did get your culture back from your sacral wound, and you do have E. coli. Okay, so this is going to take care of that. It's going to attack the bacterial cell walls and cause cell death. Okay, so it's just gonna, hopefully, if everything goes well, it should take care of that infection for you. There are a few signs and symptoms of the medication. Some hypersensitivities, allergic reactions, rash. There also could be like loss of balance, loss of hearing. I went ahead and I printed you up some teaching about the medication in case you want to look over that. It has a little bit more to add to what I added to.
Thank you.
Get everything all settled up. So let me go ahead and check your name and date of birth for me.
Marta Yarn, and it's 3/1/36.
Okay. And are you feeling any pain right now? No? Okay. If you are feeling any pain, go ahead and let me know. I do have something on order for you.
Okay.
Okay. And do you have any allergies?
No.
Okay. Okay, so again, we're going to be giving this medication You do have the right to refuse this medication. I just want to make you aware of that. Are you all right with taking this medication?
Yep.
Yep. All right. Yeah, it will be very helpful for that infection at first.
Okay, perfect.
And I'm gonna just chart really quick that it went in her right knee.
So first, I'm gonna administer the primary. So I'm gonna make sure I scan you. Can you tell me your name and date of birth one more time?
Yeah, Marta Yarn, 3136.
Perfect.
That's alright, I'm gonna label my
Alright.
tubing really quick.
And now I'm gonna check the medication. I'm gonna check, make sure it's the right medication, right dose, right time. Make sure it's clear. It doesn't have a bad expiration date. And we're doing our route through our IV site.
I'm just again
Go ahead
gonna
and
assess
scan
the
that.
gut, make sure there's no particles, make sure that it's not
And it's green, so it's good. Check it one more time just to make sure. Alright, everything looks good there.
Bag and ask for her two identifiers again.
Janae O'Connor, 34.
I'll go ahead and get my line out so I can hang it.
Alright, and this is 500 milligrams, so it's gonna run over 1 hour. Okay, cool.
Make sure
And
this
we
is
will
locked,
label this
clamped.
as well.
Alright, we take off our cap, and this is sterile, so we want to make sure we're not touching.
Just in case.
Okay, just
simulate, whatever.
Yeah, just in case they get another round.
Squeeze this so that it's halfway full.
We're also going to be looking over your
You need another
And
one?
but since you're on dialysis,
we go ahead
we're going to make
and
sure that we give it to you after dialysis.
prime the tube.
You're welcome. Clear it out with the dialysis. So since you have it already, we're going to be able to push you.
So make sure that it's clamped off, which it is, and then we would obviously label it.
Mhm.
Again, sterile, sterile, so swift moves.
All right.
Now, we have another hub that's up here, and this is what's gonna prime our line. We're gonna use the sodium chloride to prime our line.
So that means you're going to connect it to the.
Priming the line is getting the fluid going without bubbles. So I'm gonna prime my line for my antibiotic, and then we'll.
Just making sure there's no
Alright,
bubbles.
scrub the hub for 15 seconds. And I'm gonna connect.
Green.
And at this point, we'll have the antibiotics lower than the sodium chloride, so we can backflow.
Mhm.
And then we'll just open up the line, see where the bubbles come in. We're good. Alright. So at this time, our
We want to make sure we get all the bubbles out of line,
very lower than the secondary.
because that can cause some troubles for the patient.
Alright.
If I miss any bubbles, the machine is smart, so it'll catch it, and it'll let me know. If I missed any.
Nausea, vomiting, and diarrhea, and there was something else. I think you said low blood pressure or something, right?
Yeah, so just when you get up,
That's all then.
Okay.
make sure you move.
And before I connect this,
And also the
I want to
IV
make sure that your
site,
IV
if you're
site
having pain or redness, or if you
is
notice
still
that it's
working
getting
properly.
really inflamed, let us know.
Okay.
Alright, so to hang the secondary, we're gonna hit final select.
Alright, have you been feeling any pain in this area at all?
No, it feels good.
No, it feels fine. Alright, I'm just making sure it's not red, swollen.
Choose that one. Yeah. And it's 500 milligrams and 100 ml, so that's correct. So we're gonna select that one.
We're gonna scrub for
It's asking
15
this is correct.
seconds.
Yes. And it's just telling me the dose, so I'm gonna hit next. And the duration is gonna be 60
No
minutes.
air in here.
So it's gonna be 100 mLs an hour.
Alright.
It actually does the math for you.
Make sure
So it
you're
tells
gonna
me
make sure
before I
it's
hit
not
start to
expired.
Alright.
clamp the secondary line.
Okay.
So I'm gonna do that, and then I'm gonna hit start.
Seems to be
Nice.
working properly.
Alright.
And then it's good to go. I'm just gonna wait for my 5 drops.
And I can go ahead and attach this then. is sterile, so I'm gonna make sure it's not touching anything.
No, I don't.
Another 15 seconds.
That's it?
Yep, seems to be working good. I don't have anything yelling at me, so that's a good sign.
Okay.
All right, Miss O'Connor, so you're all done. You have your call light.
I don't need anything.
Perfect. All right. Thank you.
Yep. Go ahead and get this going for you.
That was nice. So I just have a few more
Big
questions.
ol' med
for
cards
you.
in my way.
Were there any pertinent pieces of information?
Alrighty.
Oh, okay, let's start over. Were there any
Make sure it's the right
pertinent pieces of
patient, right
information
floor.
reviewed before administering?
Alright, and we're gonna do channel select A.
So we reviewed the UA.
Mhm.
Reviewed the
Oh, we're
order,
confirming it's the right
there's no
patient. Channel
allergies,
select
there's no
A.
sensitivity to the medication.
We're gonna do guardrail IV
Verify that
fluids.
again with the patient.
And it's gonna be the 0.9% normal saline with sodium chloride at 20 milliliters.
Did this information affect your decision to
And
administer?
is this the right medication? Yes.
Yes, because if she had any sensitivity
And
or
our
allergies,
rate.
these are kind of similar stuff as far
We
as
just
like
double
we
check
said
with
earlier,
our
then we wouldn't
bar.
administer
It's
the medication.
125.
Alright.
And also if we didn't have anything to back up why we're giving the medication.
And
Right.
rates being or
Did this
yeah,
information
the
affect how you administer
VBT
the
or
medication?
Yes,
VTBI.
because then the monitor's gonna
It's a
tell me,
1,000 milliliter bag,
how
but I'm
much
gonna
we
go ahead
get.
and put in
And then you
950 just to make sure
fluids
the
make sure that those
line
are
doesn't go dry.
compatible. And then it's
All right,
gonna
and
tell me what
then
rate I'm
we're
gonna
go
give the
ahead.
patient.
Everything's
I think that's all of my questions.
should be
Alright,
in
just gonna
properly. Let me go
Okay,
ahead
thank you.
and start and
That was good.
unclamp.
23 minutes. I was like, oh, in that time I was scared.
That's why I just
And
leave it.
we're watching for 5 drops.
Alright.
And we're also labeling our tube.
You really gonna go right?
Alright, it's saying it's included on our patient side.
Little allergies.
So we'll make sure there's no kinks in the line, make sure
It was
everything's
going in her, not on the bed.
unclamped.
I mean, it beeped for a little bit. We got it.
I fixed it.
Yeah.
I troubleshooted. You should be proud.
Yeah, it's the sulfa tryptophan.
It's hard to pronounce it. Check the drugs. It's not expired. Check against the order.
You need what?
500 milligrams.
Those right there.
100 mLs.
Alright, so it's included somewhere on this side. Running out of gloves in the hospital.
Will you plug that up and snap that out? Sorry, we'll use. Here's your.
I'm just making sure this is.
Oh, no.
Oh, is this for the
Even that baby. Oh my gosh, you're gonna call me baby. That's how I have to talk to Cody.
I might have to get another line because this one might be broken. I'll try it one more time.
You said, take it out. Oh, did it not?
Go. Alright. So we just wanna make sure that you know the signs and symptoms of an allergic reaction.
Oh yeah, the signs and symptoms. A rash or itching and swelling in my face or
Okay.
sometimes.
That sounds good.
Well, do you know where they keep the other lines?
Yeah. Let
Okay.
me see.
Do
I'm gonna
you
go get a
mind
nurse.
if I'll watch the patient and do you mind go grabbing one? for
Yeah.
me? Okay.
Thank you guys.
Alright, so we have your call light.
All right. So this line doesn't seem to be working.
That's okay, it happened earlier.
Okay.
I'm gonna, before I go, actually, I'm gonna label my,
get one of the charge notes, and they gave me this.
Okay. Alrighty. So. Just going to toss this line
Okay.
in the trash can. Okay.
Okay. We'll let you call it if you need anything, okay?
Alright, I actually just have a few more questions for you. Were there any personal instances or information you were reviewing before administering the medication?
Just check the order, make sure you have the correct medication, check for allergies, make sure I have the right patient. Make sure she had her dialysis already, so we get it to her for dialysis. And,
Did this information affect the decision to administer the medication?
yes, if it includes the correct order, the order
That's
didn't
fine.
seem right.
Let me go ahead and scan this one more time. I think it has a timeout if we
Okay.
don't do it.
Not a problem.
Not now, 'cause I'm still
Alright, so one more time, can you tell me your name and date of birth?
Marta Yarn, 3136.
Okay. And this is the right drug. It's not leaking. Dang. Okay, one more time. I'm sorry.
It's okay. Marta Yarn, 3136.
Okay. And then the right drug, right time, right patient. Okay, and we're green. So we're
Yay.
good. Alrighty. Again, sterile. So we'll make sure it's not touching. Can you hang it? And tell me when you're ready, okay? Then we have to turn it on.
What is the term?
Oh my gosh, what time is class? Okay. Time the line.
You were moving away and I'm like, don't turn around.
Oh, yes, sorry. I'm just so used to doing it.
I can already tell this one's probably going to be a lot better because these bubbles are coming out a lot more smoothly.
That's good.
I don't know, sometimes the manufacturer just sends us a bad line for whatever reason. It gets by those people that inspect it, make sure it's good. Okay. So, no bubbles, no troubles. So hopefully.
Okay.
And it said it was occluded on your side. I already checked your site and it was working, but let me go ahead and check it one more time just to make sure.
No, there's one that's just on the side, whatever.
Do you want me to hold it when you're done?
Oh, give me that, I got it. Give me the.
Hi, Barney. Hi. Hi, I'm a level 1 nursing student. I wanted to know if I could come watch you with O'Connor.
Sure.
Yep, it's working. And keep that
So
attached.
we are going to be taking care of Miss Shanae O'Connor. She's a 37-year-old African-American female.
Alright,
She's
again.
31. She's a full code. She
Keep
is
this sterile.
she has an allergy to I can't even say it, but trimethoprim, sulfamexazole. It causes a rash when she takes it. Okay. So she presented to the ER with fever, chills, and general malaise. And let's see, she does have diabetes mellitus type 1 and end-stage renal disease. She came to the ER, like I said, at 5:30 with fever, chills, and general malaise. She reports
Right,
elevated
again,
blood
right
glucose
patient.
readings and decreased appetite for the past few days, and
Right
minimal
floor.
urine output for the last
Confirming
month.
the patient.
She has history of renal
Channel
failure,
select.
secondary to
Barbell IV
diabetic
fluids.
neuropathy, and
The
hypertensive
0.09% normal saline with sodium or potassium chloride 20
for about 1
millicubics.
year. She's
Is that the
been
right
listed for
one?
transplant,
Yes.
6
Right
months
to be
ago.
infused. Again,
Let's
making
see,
sure we're
she's
double checking.
diagnosed
It's
with
125
type 1
milliliters per
and
hour.
she
Right, to be infused, 1,000
did have
milliliter
a,
bag. We're gonna go ahead and put in 950 so it doesn't run dry. And then
She
we're
had
going
a
to
left Pharm
start
IV graft surgery created 11 months ago with no complications.
and watch for 5 drops.
She had tonsillectomy when she was 10.
And
Let's see.
put
She
our
did
label
have that
on there.
graft infection 3 months ago as well, which was resolved after IV antibiotics. And she has history of recurrent urinary tract infection. She's well groomed, well nourished, who appears older than her stated age of 34. She's in no acute distress, but appears generally uncomfortable. Her pupils are equal, round, and reactive to light. Her sensations are diminished in the lower legs.
Oh, it looks like
As
it's
far as
going now.
respiration, her chest expansion is symmetric. All lobes are clear to auscultate.
Okay,
She reports that she
there we
quit
go.
smoking
So let me
2
go
years
ahead and
ago.
document this one. How are you
As far as
feeling?
I feel good.
cardiovascular, She's a little tacky, but regular rate and rhythm. S1 and S2 are present. There's no murmurs or extra cardiac sounds. There's slight 1+ non-putting edema in the lower extremities. Her femoral pulses are 2+ bilaterally and +1 pedal pulses in both feet. Her capillary refill is less than 4 seconds. She does have an IV on the right median vein. It's 18 gauge. It's clear. There's no red swelling. It flushes easily. Through the IV, we're going to be getting her normal saline 0.9%. Continuous, as well as her
Okay,
antibiotic.
so let me go ahead and give you this gentamicin. Do you remember too those side effects I told you about?
Yeah, I think you said loss of hearing and balance.
Okay, just want to make sure you're aware of what it could cause. Can you go ahead and tell me your name and date of birth one more time?
Yeah, Marta Yarn, 3136.
Perfect. Okay, right patient. We're going to make sure we have the right drug. This is gentamicin. It's it's our IV piggyback. It's going to be run every 8 hours.
GI, she did report
I'm
of
going to go ahead.
weight gain of 10
I
pounds.
checked the
Like I
expiration date.
said, decreased
That's
appetite,
good.
decreased intake.
And
She's on a
clarity is good, no
diet with
leaking.
1,500
Go ahead and
restriction
scan it.
a day. Her abdomen is soft, round, non-tender. There's no visible masses.
Green.
No
That's
organomegaly.
good.
Bowel sounds are present in all quadrants. As far as GU, there's no bladder distension. She does report decreased frequency of urination, and volume urine recently became more concentrated and darker in color. We did spray catheter and got 200 mLs out.
And for our
As far as
secondary,
labs and why we're giving her,
we're going to go ahead and make sure that this
we
one's
did a UA
paying.
and found WBCs
The primary is
in there.
paying lower.
CBC and metabolic panel are still pending. So we're gonna go in there and give her that Premaxin IV piggyback and normal saline 0.9%. Okay. I believe that's all for her.
Alright, I just have a few
This one's
questions.
correct.
Why is this history of the
Alright, this is sterile.
So because of her recurrent history of UTIs, we're gonna prophylactically treat her with this antibiotic Premaxin.
Okay.
Fill it
What
halfway.
action does the medication have?
We're going to prime, but we're going to do it super slowly because we do not want to waste any medication.
Okay. When should you question administering this medication?
If at any time you know
Okay.
that there's sensitivity or allergy to penicillin or cephalosporins,
Here.
we would think twice about giving it.
Okay. Does the medication have a therapeutic serum level?
No, it does not.
Go ahead and
And which
attach
vital
it.
signs must be monitored?
We monitor the temperature, watch out for any fever, and overall just vital signs and the status of the patient while they're receiving the treatment.
Okay. And which physiological parameters should be monitored when the medication is being administered?
We want to watch the IV site for any
This is
pruritus,
sterile,
redness
so
or
we're not-
pain, edema, also any body rashes or reporting itching at the IV site or skin.
Did
As far
touch
as
the
lab
outside, so
values,
just gonna
we
be
wanna
more
watch
time.
UN,
Just wanna be extra
ALT,
safe.
LDH,
Patient's already got one infection, we don't want another.
That sounds good.
And hemoglobin and hematocrit may decrease, and like I said, temperature.
So go ahead and
What
get that
infections must be
attached.
taught
Now
to
let's
the
go ahead and
client to
set
ensure the
that.
medication
So
is
we're gonna do
administered safely
channel
in a hospital
select.
setting?
So we want to make sure we do the
We're gonna
three
hang a
checks,
secondary.
also acknowledge the
We're gonna
five
find
rights,
it,
the right patient, right time, right dose,
gentamicin.
right medication, and the right route.
Every
We also
eight-
wanna check for
8
IV
hours.
compatibility with the,
And it is the
antibiotic.
80
That's
milligrams to
very important.
100 milliliters. Yep.
We want to check for IV patency,
Alright,
and we want to make sure that we
and
explain to the patient why they're
yes.
getting the medication, and have
It's just
them,
double
tell
checking,
you
make
the
sure
side
everything's
effects, so that
right.
way they know why they're getting it, and what
Alrighty, and our duration is
stuff
1
or,
hour.
like I said, side effects to watch out for.
Okay. And what interventions must be taught for taking the medication
And
safely
I
at
just
home?
want to double check one more time.
You're gonna make sure to tell them to take the full prescription.
And everything's good, so we're gonna go ahead
and
saying,
to,
make sure
if they notice any like diarrhea with blood or pus and mucus in their stool and fever, you want to let them know to contact the physician.
We're good.
Okay.
How you feeling?
And,
I feel good.
You're feeling good? Okay.
So nausea,
So let me go ahead and clean up some of
diarrhea,
this stuff
rash, thrush,
and
provided the IV site, skin infection,
document.
hypertension, seizure anaphylaxis, and C. diff associated diarrhea.
And how will you know the medication is effective?
We're gonna make sure or check her temperature. It should go down. And we're also gonna recheck her urine analysis and culture. And her urine output should increase as well.
Okay, that's all I got.
All right, so now we're gonna go ahead and enter her room. She's in room 31. Knock, knock, knock.
I think I already asked, but did you
Hi, Miss O'Connor.
report any
How are you?
did you have any pain? I
My
can't
name is
remember if I
Molly.
asked
I'm
or
gonna
not.
be your nurse
You
for
did.
today.
I don't feel any pain
You don't feel
though.
any pain? Okay.
So
Let me go
just
ahead and
plug in the
finish
computer.
documenting this, and I'm gonna go ahead.
Alright. So,
And
the doctor has ordered
label my line.
Relaxin, which is an antibiotic.
And
We were
watched
looking at
it
your
drop
urine
5
analysis and we found
times.
some white blood cells in there, which is abnormal. So we're
So,
gonna treat you for that.
I'm all done documenting.
Have you ever had this before?
Pop seems to be moving
No.
smoothly.
No.
You're feeling okay?
Mhm.
Good. Alrighty. Did you have any questions?
No.
Not right now? Okay.
Before we get started on that, let me just verify that you are my patient by asking you your name and age.
Janine Connor, I'm 34.
Okay. And
Go ahead and
any
lower your bed.
allergies?
One is
And you have your call light.
Yep, I have it right here.
That one, very good. Okay, so you're actually going to be getting some fluids.
Alrighty.
Sodium chloride, normal.
I'll check
saline,
back up on you in about
It
30
says
minutes,
here
okay?
It's going to be
Sounds good.
continuous, going at a rate of 30 mLs per hour.
Okay.
So let me just pull out normal saline.
Okay.
So here it is. We want
Did you have any questions you didn't want to ask in front of the patient?
that's okay.
Yeah, so were there any pertinent pieces of information you reviewed before administering the client the medication?
Yeah, so I wanted to make sure that, I checked the orders, made sure that the patient wasn't allergic to it. I asked her if she was allergic to any medications we weren't aware about. Made sure that the medications were Y compatible. I think that's about it before I administered the medication.
Did this information affect your decision to administer the medication?
Oh yeah, so if any of those things I said earlier, they weren't, it wasn't compatible, patient was allergic, I would have probably called the provider, made sure that,
Also going to check.
made sure that,
Just make sure that.
I'm sorry.
Fine.
I thought I heard somebody say something back there. Okay, make sure, can you ask the question one more time? I'm sorry, I'm losing my train of thought.
Did this information affect your decision to administer the medication?
Yes. Okay. So if the medication wasn't Y compatible, or if she was allergic to anything, or showing any adverse side effects, I would have called the provider. Probably got something else going for her to help treat this infection, or maybe a different route of the medication.
Around your IV site?
Okay, did this information affect how you administer the medication?
No redness or anything?
Yes. If again, if it wasn't compatible, then I probably would have done it through a different route. And yeah, that's about it.
All right, that's all I have.
Cool. Okay, I'm gonna finish documenting. Did you want to watch?
Sure.
Okay.
She is sinus